Hi, everyone. I wanted to talk to you about our new paper that we published called Patellar Apprehension is Reduced in Most, but Not All Patients After Successful Patellar Stabilization. When we see patients with patellar instability, we've all been taught to perform a test called an apprehension test. And this is where we push the patient's kneecap to the outside and see how much apprehension we see on their face, hence the name of the test. When we're in medical school and in residency, we learn that this test tells us whether or not a patient has patellar instability, and that if we stabilize that patella, that apprehension test will go away. And this test has traditionally been performed and graded by the doctor, and they classify it either as positive or negative. So the patient has apprehension or they don't have apprehension. But as you know, patients have different reactions to many of the different tests we do. So in this study, we wanted to look at this test. We wanted to see if it was valid and reliable, not only with the surgeon grading it, but what did the patients think of it when we performed the test on them? So we looked at the test not just as positive or negative, but we asked the surgeon and the patient to grade it on a 10-centimeter line, where 10 was like the worst apprehension ever, and 0 was no apprehension at all. Because we all know that some patients may squirm a little bit and other patients will punch you in the nose and jump off the table. So we wanted to find out whether or not this test was not just positive or negative, but how hard it was for the patient. So we also asked about the quality of that apprehension. So some patients just say, yeah, I don't like that very much. And others would clench their muscles and not let us touch their knee. Others, their heart started racing and their faces turned red. So there's some quality to that apprehension that we wanted to capture. Well, what did we find in this study? We looked at 89 patients who were 2 years after their patellar stabilization. We had the surgeon and the patient grade their apprehension, and we had them do it before their surgery as well as 2 years afterwards. And we asked them to describe what the apprehension felt like. So what do we find? Patients, unbelievably, graded their apprehension much higher than the surgeon did. So what we found was surgeons underestimated the amount of apprehension that a patient feels. Overall, if you looked at all the patients we looked at, the apprehension was decreased after surgery, but only 56% of patients had absolutely no apprehension post-operatively. 16% of patients had no change in their apprehension, so it was the same before surgery as it was after the surgery, even though they said their knee was stable and they didn't have it dislocate anymore. The final 28% of patients had a significant reduction in their apprehension, but it wasn't completely gone. We looked at all the anatomic risk factors that these patients had, and we could not correlate any of the risk factors to whether or not their apprehension disappeared or stayed the same. But what we did find is patients who had less apprehension scored better on their quality of life questionnaire. So, in summary, the apprehension test did show some validity and responsiveness to change, so it got better after surgery, but then persistent apprehension did correlate to a decreased quality of life. What does this suggest? Well, these findings suggest we should be careful about how we use the apprehension test. It may work well as a physical examination test or to diagnose a patient, but it may not be so good to be used as an outcome measure or actually defining whether or not a surgery has been successful or not. Thanks for listening.